Hello, I'm Sumi Das for MoneyWatch.com. Cobra, HSAs, IRAs, 401ks. The self-employed have an alphabet soup of plans to choose from when considering options for health insurance and saving for retirement. And the decision on what to do can be especially daunting when you're on your own, as is the case with freelancers and small business owners. Bill Shireman runs his own business and says after struggling for a while, he finally has it figured out. He recently created his very own do-it-yourself benefits package, and he's here to tell us what he learned. Bill, thank you so much for being with us.
Glad to be here.
So we're going to start with health insurance. Tell us the common mistakes that the self-employed normally make when they're trying to figure out which health insurance plan to go with.
I think we tend to buy too much insurance. We treat insurance like it is a prepay system for health care, which means that we have to pay the insurance company first to take their cut to pay our providers, and it just wastes a tremendous amount of money. I found that what you've got to do is, if you're single, take out a catastrophic insurance policy. If you're a family, have a high deductible so that you choose your own care, you pay directly, and you'll find that you pay a lot less overall. I think I've saved probably $30,000 over the last 10 years by doing it myself.
So you decided to go the high deductible route. Tell us, how it's helped you out.
Well, it's helped me out because I don't have to pay an insurance company half or a third of my health bill. I pay it directly to the providers every month. Exactly. I find, first of all, I make good health decisions when I do it that way. And secondly, if you go to a healthcare office, about 80% of the time I find they have a secret little rate sheet for people who don't have insurance to cover their day-to-day services. And they're about a third or half what the rate is for the insurance companies. And it's because they don't have to go through the rigmarole with the insurance companies. So you pay much less up front. Plus, if you do have a catastrophic or a high deductible plan, your insurance company will also have negotiated low rates on all the other items that they cover. So you get the best of both worlds. The low costs that the insurance companies have negotiated, plus the even lower costs that you can generally get by working directly with the health provider.
That brings us to retirement, because hopefully you can use the money that you're saving on health insurance and put it towards your savings for retirement. You said that you struggled initially, so tell us what you did wrong when it came to selecting a retirement plan.
Well, I'd say I did one thing wrong and one thing right. What I did wrong was to scatter my investments across, the wide field. It's great to invest in things that just interest you, and that's fun, but it was a mistake to just have a scattered set of investments with no theory behind it, no plan behind it. So that's what I did wrong. What I did right was I maximized my deductions early on. Every opportunity I had to put money into a retirement account tax-free, I took that opportunity, and thank goodness I did now, because I would be way behind the 8 ball, especially with the economy where it is, if I hadn't done that smart savings early on.
There's so many options when it comes to saving for your retirement. What did you end up going with, and why?
Well, I'm a very busy person, and I always forget what all of these initials stand for. So every year at tax time, I have to remind myself. But basically, I've got two retirement systems. One is the SEP IRA for my self-employment income, the contractor income that I have, and the other is a simple IRA for the income that I receive as an employee of my nonprofit organization. I maximize both of them. So I just push the little buttons on my computerized tax forms and maximize both of them. It ends up being 15 or 20% of my annual income, and I take that out. I don't ever see that, so I don't spend it. That's the smartest thing I've ever done, was just taking that money out, maximizing it. I would encourage that to everybody.
What type of advice do you have for somebody who's just finding themselves self-employed for the first time and needs some help figuring out how to create their own DIY benefits package?
Well, I would recommend you go to a firm, not a big upfront fee firm, but a firm that can work with you on one master account to plan for your retirement. How much money are you going to need in your retirement, and how much money do you have to set aside, given conservative assumptions, to reach that level at the time that you're going to need it. And then put that money aside. And one of the best ways to put it aside is to save on the healthcare side. So on the healthcare side, cover yourself a la carte as you go, but make sure you have an insurance policy that will cover you in the event of a catastrophic incident or something that would push you over, let's say, your limit. $5,000 a year, $10,000 a year, $3,000 a year, whatever would be catastrophic for you, you want to make sure that you've covered that with your health insurance, but no more, because it's just money out the door.
Bill Shireman, thanks for being with us today and sharing some smart advice.
Thank you.
For MoneyWatch.com, I'm Simi Das. Thanks for watching.